Hi, I'm Dr. Lam from the BetterBack Clinic. If you're watching this video, it means that you're one of our patients seeing one of our amazing chiropractors at the team. So this prolordotic neck exercise I'm going to demonstrate here is designed by the chiropractic biophysics, which is one of our core chiropractic techniques being used in the BetterBack Clinic. Now, in the modern lifestyles that we have right now, we are dealing with a lot of different kind of stress. A posture stress, injury stress, or just not moving for a long time over the years kind of stress. And even sometimes could be, emotional stress and all this kind of stress. So the prolordotic neck exercise, is helping us to release the tensions, release the stiffness on your neck and shoulders so that your body start to move well and feeling better and getting things working better. And the good things of doing it at home is also helped you to able to empower you to do these exercises to continue to build on top of your body movements and strength. Now when you're doing this exercise, make sure that you have to use it during your pain-free range of motion. Now what does that mean? If I tip my head to the left side over here and then I suddenly start to feel a very pinchy or painful sensations going down to specific area in my neck, then that is my pain range of motions with pain. So I have to probably need to back off with my motions when I tip to the side by not pushing it all the way to the end. If you're also experiencing any discomfort or painful sensations or any radiation down to your hands and fingers, make sure that you stop this exercise as soon as possible and consult with one of our chiropractors when you're in the clinic. So at the clinic, you were able to see one of these bands hanging on the side of the wall, but you were also able to purchase that to do it at home as well. So first thing about it, you would see that there are two handles. One is on the right side, one is on the left side. And there is a cushion just right in between as well. We have bands that is very similar in terms of the design, so they all work very similar. But there's one thing that's different is the color. So we have red color, which is about only 10 pounds of pressure, which is the lightest. We have another color that's blue one, which is 15 pounds of pressure, which is we call the medium pressure. And then we have a green one, which is we call the Hulk, because it's green. And then the pressure would be the highest, would be about 20 pounds. So we always encourage you to start with the lowest pressure, which is the red one to begin with, and build up your tolerance over time. Okay, so first thing first, when using these bands, is making sure that this band is sitting right on top of your shoulder behind your neck right here. Okay, just want to turn the other side just so you can see it. The second part of it is where your hands go in terms of this handle. So you want to go underneath of this handle and then making sure your hand is grabbing it with 4 fingers on top and then the one down low right here. Okay, now and then you can do the same thing on the other side over here. One of the things that I want to point out too is that different angle of this band, when you're pushing the band forward, it will target on different levels of the neck. For example, you can imagine the natural curvature of the neck. There's 7 bones in the neck and they're supposed to be normally alignment. Healthy alignment should be bending backwards. So if we are pushing the band close to slightly down angle, it will target more on the lower part of the neck. If we push it straight forward, it will target on the middle part of the neck. And then if we push it up, that will target on the upper part of the neck. One of the most common rules that we will suggest is that we'll start with the lower part of the neck, just pushing down this way. But if your chiropractor suggests that there's a specific angle that you need to use this band towards to, then they'll let you know on the day when you learn this exercise. Now, when you're pushing the band, one thing I want to mention, one of the common mistakes as well, is that when you push the band, the wrists start to extend this way. This is not a good position because that would put extra strain towards your wrist. We don't want to have additional injuries or stress into other joints in the body. So when you're thinking about pushing the band, you're almost thinking about you're doing the push-ups. But also at the same time, make sure your wrist and the forearm should be on a straight line as you push. So it will look like this. Okay. So as you're pushing the band forward, you should also feel the pressure from the cushion towards your neck, and that's completely normal. So once you feel it, so I'll push the band forward. Once I feel it, putting lows towards your neck, and then I start to tip my head up to the ceiling within my pain-free motion and hold 3, 2, 1, and return back. And I'm gonna do another rep. Look up again, hold, 3, 2, 1, and relax. The second exercise we can do is that as we are pushing the band forward and tip our head up, I can return back after just holding for 1 second and relax my arm. And now I'm going to do it again. And backward. So this one, we call it the pump. We're just holding it for 1 second with the arm straightened out. And then come back, relax the elbow, do it another one, and come back. So that's called the pump with the head bending backwards. So now we have learned 2. The third one we're going to learn is that we're going to be we're doing side tipping, side to side. The neck has 3 major functions. One is looking up and down in this plane. Second is side to side, going left and right. And then the last one is shoulder check, which is turning left and right. So you're going to make sure all these 3 planes of motions is all smooth and warmed up and loosened up. That's going to help our spine, neck, shoulders to working better. Now, the third one we're going to do is, now you can see me facing over here. We're going to push the band forward, and this time we're going to try to bring your left ear to the left shoulder. Hold for 3 seconds, coming back, holding the band in tension to the right. 3, 2, 1, and relax. One of the common mistakes I've noticed with my patients is that you're trying to avoid. So when you tip to the side, make sure your shoulder don't start tipping over to the other side. Why is that? Because that may be a sign that your shoulder are compensating from the stiffness of the muscles and the joints of the neck as well. So trying to maybe the first few times as little tips, trying to do it in front of the mirror so that you can give yourself some visual feedbacks through your nervous system to tell you whether you are actually doing it without you noticing it. So last one we're going to do is that we're going to do the shoulder check motion. So same thing, we're going to have your band pushing forward. This time we're going to be rotating your head towards the left as far as you can. 3 seconds hold, come back, and do the right side. And relax. Okay. So these are all the exercises with the prolordotic neck exercise band that we have. Now, how many repetitions, how frequent we have to do? Here's what the ultimate goal is. The ultimate goal is doing 20 repetitions on each direction and do it at least once a day. But you may want to ask, okay, I cannot do 20. How can I start? That's good question. So you're going to build up your tolerance. You may be able to start with whatever you're comfortable. Maybe start with 5 repetitions on each direction. And that may be the limit for today. But you always think about you slowly progress your repetition and how long you do it for, how frequent you're doing on over a period of time. So maybe you can only do 5 repetitions for each direction today. But doesn't mean that tomorrow you can only do 5 again. You maybe do 6, do 7. But a gradual progression sets some realistic goals. Slowly get to the ultimate 20 repetitions. That would be my recommendations. Now, one of the things that most patients will ask me as well is that, can I use something else to replace this band? The answer is yes and no. Yes, you can use whatever band you can find. To resistant band, elastic band, towel, whatever you can find to do this exercise. However, the disadvantage is that those bands are not specifically for your neck and shoulder. They're being used for everything else. For example, you use resistance bands for leg exercise, arm exercise, whatever exercise. Towel is designed to not for exercise, it's just for something to do something else. The way that why they designed this band instead of just telling you use the resistance band and towel is because it has a specific tension and specific contact and specific diameter of the cushion that's specifically for your neck and shoulder. And they have scientific reports and evidence to show that if you combine these into your chiropractic adjustments or tractions and partial rehab, it can actually show improvement in terms of your curve alignments. Now, does the resistance band and the towel show the same result? The answer is no. That's why this evidence-based support that this exercise band works. Now, of course, you can choose at the end of the day whatever you want to do it, but just bear in mind the safety, whether it is safe to do it, whether it's going to hurt you if you use something else. I cannot expect that may not happen because I've never used that. Or you can try it and it hurts you, that's the only way you know. But these bands have shown a lot of safety, a lot of effectiveness into how good they're doing for your neck. So make sure that you use the proper tools for the best of your neck and shoulder. Now, here's the end of the videos. If you have any questions, you can always ask one of our technical team or one of our chiropractors when you're in the clinic. You can also send an email to behealthy@betterback.ca or call us through this phone number. Thank you for watching this video. Hope you guys enjoy the content. We'll see you next time.